Thank you very much. Great to be here and super excited for the opportunity. And, one of the things, just a little background around Certintell, we, exclusively focus on federally qualified health centers. We have worked with some rural health clinics, as well. And, really our goal is help as a social impact focus is really help closing the care gap. That's our core mission statement, what we've been doing for a long time. We've been fortunate enough to have some early opportunities with FQHCs around remote patient monitoring. We've learned a lot. We'll touch on that. We also work with now multiple health center control networks as a lot of their shift and focus. And folks that don't know what a health center control network is, they're there to help support federally qualified health centers and implementing electronic health records, optimizing that. And there's really been a shift because of COVID-19 focusing quite a bit on telehealth and connected devices. We've been fortunate enough to be partnered to support with some FCC grant funding to support those types of programs around remote patient monitoring, which is what we call telehealth, 2.0. But one of the things that we learned a lot is the technology is great. It's important. Everyone has kind of touched on the key hot buttons. It's got to be accessible to patients, which typically means not having to have Wi-Fi in the home, be out of the box, able to use. And I would guess that almost everyone on here has that core, and we'll touch on that a little bit. But one of the challenges that we saw by working with implementations, even with smaller grant-funded projects around remote patient monitoring, is a shortage of staff. Certainly with COVID, a lot of organizations had to furlough staff. Folks are overburdened, just spread thin as far as from a clinical team to engage. So the technology is important, but do organizations have the support to scale? And the big part, of course, is monitoring the alerts, reaching out to the patients when there's an issue, reaching out to the patients when they're not taking the readings. But more than that, when you have that touch point, to be able to have trained staff, they're going to have an impact on behavior change when they get that touch point. And so as an organization, we're excited to touch on our platform in a bit, but what we do in support, just really understanding the challenges that FQHCs have of the number of FTEs available to really scale a program like remote patient monitoring. We want to help and be an integrated partner to really take that barrier away. And we do that with what we call our certified clinical health coaches. We'll touch on that in a minute, and how they're integrated with your clinical staff to really support a scalable remote patient monitoring program. And through our experience in clinical workflows, how from the patient perspective, they don't really know that we're not actually employees of the clinic, but they just know, hey, I have a health coach from this FQHC that's supporting me in my overall health journey. And so, what is a behavioral health coach? This is important. They're really behavior change specialists. We've taken a lot of time and effort through one of our key partners. We're out of Des Moines, Iowa, called the Iowa Chronic Care Consortium, or clinicalhealthcoach.org. It's a nonprofit organization. So all of our clinical staff that are trained on our remote patient monitoring portal and equipment also go through 40 hours of training around being behavior change specialists, all in an integrated way with our FQHC partners. And so we help identify patient health goals and barriers, help create an actionable care plan of action, and really provide a patient-centered resource in between those in-person office visits. So as the end goal is really improving patient engagement and self-management. And so what's critically important about what we do too, we have significant training on social determinants of health, understanding the challenges with the FQHC population, whether it's Medicare, Medicaid, dual eligibles, uninsured, who are engaging to really have an effective impact and understand those challenges that they have. And so get to the platform in a minute, the technology piece of it. But again, what we created a unique model that allows us, as folks have talked about, there are current barriers for FQHCs and rural health clinics that bill for some of these new Medicare remote patient monitoring codes that are exciting. But even again, if you could, the challenge is going to be having the staff in place, the highly trained staff, to really engage patients around a remote patient monitoring program. And so we integrate that with our clinical staff and lead as an extension, as a partnership with your organization as a health center. And so again, we start with our processes from an enrollment, which is important. There was a question around how do you identify risk and all of that. We have a NCQA certified health risk assessment. We have integrated that we go through with every patient before we would enroll them in remote patient monitoring. It's great because it helps in a really clear and understandable way, spits out a physician summary and a patient summary to really help evaluate which patients would be best served enrolled in remote patient monitoring. We have one specific to Medicare and one specific to Medicaid patient populations as well. And after, in a collaborative approach with our FQHC partners, we evaluate who's best fit, and then we do turnkey supply all the devices into the patient's home based off their health risk results. And so when you look at what we do to support FQHCs, again, you all do a wonderful job of providing comprehensive care, dental, behavioral health, medical, preventive service, all of that. What we're here to do is take some of that burden of limited time to spend from a time-based perspective in your high-risk patients. And so our health coaches reach out to the patients, contact them, consent them, enroll them in the program, and again, educate them on the devices. And I'll reiterate what a lot of other great companies have said and will continue to say is that, all of our devices we connect, our cellular connectivity. We'll talk about a unique partnership, a unique hub that we're super excited about to bring in multiple devices that the patient may already have that are Bluetooth enabled. But in partnership with our FQHC clinical staff, because they're your patients, again, we collaborate on target ranges, when should patients get alert, but again, we triage that to take some of the burden off of the staff internally. And again, folks talked about some of the sustainable opportunities with Medicare and dual eligibles as well. Sometimes we forget that with a lot of dual eligibles on Medicare, Medicaid, that they're eligible for these new remote patient monitoring codes that are out there. What's unique about our model is that we are a virtual medical practice that's credentialed with the payers. So in partnership, we can actually drive the billable codes, they're time-based codes, so we can collaborate together to make it sustainable that's not just dependent on grant funding situations. And so again, all of this you all know about, monitoring. It's all about the patient outcomes-driven approach. We're early in the stage in this new model, but again, we have some strong partnerships with 6 health center control networks to scale this. We're really going strong in states of Louisiana, Mississippi, South Carolina, for example. Utah is another health center control network that we're rolling this out and having really early success in partnership, getting patients that at risk devices they need, and in partnership driving that engagement in a coordinated care team approach. So again, everything as what we do is we're culturally competent. We understand the challenges that your patients have, because this is all who we focus on. And so again, we're there to provide in a collaborative way, rapport with patients, emergency protocols, and really streamline patient enrollment without having the FQHC have the burden of doing that all in-house. We're just here to help. And again, what a lot of the platforms have already talked about, we're no different. We're able to set parameters and alerts based off, when the patient should take their readings. That's a big one, right? A lot of times we focus on when the patient is out of range, which is important, but based off the clinical workflows and protocol of our FQHC partner, whether it should take the readings daily, every other day, the patient will get, of course, from accessibility, a text message. And what's also unique about our platform is phone alerts as well. So once the patient's in the system, certainly they can get SMS reminders. There's a comment or about, well, even some patients struggle with text messaging or access. We can also set them up in the system to get phone reminders. So it'll be an automated phone call to take their readings, and of course, if they're out of range, to alert not only the patient, but of course our clinical health coach, as well as the FQHC care team, to collaboratively engage the patient. And so again, patient communication, we're there for technical support and provide patient education and resources. through our clinical workflow. And then again, just really take some of the burden off with the team that this is all we do. Clinical oversight. We have a medical director, nurse practitioners, but our core of who does the yeoman's work are our certified clinical health coaches that are typically CMAs, LPNs, RNs, again, highly trained to be behavior change specialists. And so our process is about being trust with partners, doing it in a sustainable way, because we're able to actually bill the Medicare codes as a non-FQHC entity that's credentialed with payers, particularly focusing on Medicare, and we've gotten credentialed with many Medicaid plans as well. We know we're not quite there yet for RPM around Medicaid, but we are going to get there, particularly with the success around COVID of the Medicare RPM program. We hope that starts to trickle down to Medicaid. But again, a lot of our patient population we engage are dual eligible, so they have Medicare coverage, eligible for the Medicare codes, but also, of course, have Medicaid because they're underserved and low income. And these are the patients that are at the highest risk, multiple chronic conditions. Many of them tend to be older, having the higher risk of mortality around COVID. They're scared to come into the clinic or can't get into the clinic. And again, our goal in partnership is to do that. And we're starting to track outcomes today around patient engagement, all the core things around the quadruple aim that are important to FQHCs. So a quick end, just a quick view of a portal. We're absolutely excited about going in a more deeper dive in the demo of the platform. I'll show you a little bit of some readings, but a couple key points that the thoughtfulness of how this was built is that, we wanted to be patient focused. I think earlier on there was a comment around that. Couldn't agree more. It's about being patient focused. And so as you can see, our alerts, our reminders, the patients don't have to have a tablet or send them a smartphone. Again, we know some have challenges around, don't have a smartphone, of course, but perhaps you get access via SMS or have a phone. Those are how the reminders happen. But not only that, the patient can also allow through the patient access, send reminders and alerts to their family members, loved ones that are also engaged with the patient, because it takes a community to really make an impact around many of these patients that are having health inequities and challenges on that. So sometimes just having their sister, or brother, or mom, or son that also gets alerts reach out, hey mom, you haven't taken your readings, what's going on, to have an impact. And our system allows that type of engagement and functionality. And just a quick view of, the platform, similar to what some of the other organizations have talked about, to be able to log in as a clinician and view alerts. Yellow, we're above the limit, green is, is good. And to be able to then drill into the different dashboards for the patient as well, and be able to view over time the different graphs and logs from systolic to diastolic, either in a graph or log area. The same with weight, glucose, and blood pressure as well. One of the things that I always want to do, some people may want to just see, well, how if you take a reading, how does that look to the patient? I'm actually very quickly going to take a quick reading. I have a blood pressure cuff on now, and just show kind of what the patient views from an SMS, text message, alert, or via phone when they're out of range. And while I do that, again, touch on some of the key functionality around that go beyond just the remote patient monitoring. Because remember, our health coaches in partnership, certified clinical health coaches, are engaging with the internal FQHC staff. We can also do med alerts. So as we know, the med's able to pull med lists, be able to integrate that into our system, and also do the same with med reminders as well. And of course, it's all in partnership with our FQHC internal clinical team to set targets. And we can do different surveys and alerts, and of course, have some analytics dashboard of how the patient's viewing over time. We can track, of course, the engagement time to bill for the Medicare codes, but also what's the ROI from a cost of a staff, how much time they're spending. As it was touched on, you got to look at the clinical ROI as well. But we're super excited to, in the future, go on a little deeper dive within the platform and look at that, and keep, show you what we're doing with other health center control networks and their FQHC members.